My name is Farah Ishtiaq, and I'm an evolutionary ecologist. I work on birds, infectious diseases, and wastewater epidemiology. Water is essential for life on Earth. It is the fundamental indicator for health of our ecosystem. While we all strive to live in clean and healthy environment with access to clean water, we hardly appreciate the value of wastewater. Wastewater can tell us volumes about the health of our community and our environment. And the idea here is very simple. Most pathogens of interest, like bacteria and viruses, they can live for days in the sewage water. So wastewater-based surveillance is very economical and very feasible, especially for a country like ours, India, where not everybody have access to healthcare system. And most of our disease data rely on testing symptomatic individuals. So the concept of water-based epidemiology is not very new. It has been used for more than 40 years in several countries to track diseases like measles, influenza, AIDS, and even polio virus. Do you know that wastewater testing played a crucial role in the eradication of polio virus in India in 2012? The World Health Organization certifies a country polio-free if there are no cases of acute flaccid paralysis for at least 3 years. Now that's where a systematic wastewater surveillance comes into play. By detecting wild polio virus in the water, you can actually estimate presence of one individual in around 10,000 inhabitants. Now with a very systematic sampling and tracking this virus in the water, you can actually narrow down into different localities and find those areas and prioritize them for vaccination. Wastewater testing can detect the presence of SARS-CoV-2 RNA in the water 7 to 14 days in advance. So it's very useful as an early warning system to detect the presence of asymptomatic individuals in the community, and it's especially very useful into densely populated areas. Such surveillance has the power to predict neglected and emerging infectious disease. It is very feasible, economical, and as well as with the recent advances in the science and our testing facilities, we can actually collect real-time objective data to predict the emergence of these diseases. So for example, using metagenomics to understand the diversity of bacteria, viruses, and other pathogens in the environment, looking for antimicrobial resistance genes, it's a very important, very useful, not just for the human, but for animal health as well. And that's what exactly we need as an evidence-based approach more than ever, to have this One Health approach to recognize the interconnectedness between human health, animal health, and the environment. This is even more important now with growing urbanization, change in land use pattern, and also climate change. Our cities are posing a constant challenge to the global health and epidemiology of infectious disease. What we need now is a transdisciplinary collaborative approach where not just scientists or ecologists looking for drivers for diseases or pathogens in the environment. We need politicians, sociologists, everybody coming together and make a very robust monitoring system for diseases and make this wastewater testing as an integral part of our healthcare system.